Welcome back, and in this video we are going to discuss about the glenohumeral joint motions. So far we were discussing about the shoulder complex biomechanics, and now in the glenohumeral joint we have to discuss about the glenohumeral joint range of motion or glenohumeral joint motion. It's quite different from the range of motion that you are aware of, because the range of motion that we often refers to is the complete shoulder range of motion. For example, someone asks you what is shoulder flexion, the immediate answer that you are going to give him or her is 180 degree. The same with abduction, the same with extension. That is because we refer in general to the shoulder complex as such. But shoulder complex is in fact made up of, we know, sternoclavicular, acromioclavicular, glenohumeral and scapulothoracic joint. Here we are going to discuss about the motion of glenohumeral joint in particular, and it is a bit confusing discussion because it's a bit heavy task to understand the glenohumeral joint individual role when all range of motion has the complete shoulder as a whole involved. But still we'll do it in an easy manner. So we will be discussing about the glenohumeral motions as well as the intra-articular motions that are very crucial with respect to the glenohumeral joint. Yes, the first thing that we need to discuss is about the glenohumeral joint motions. And what type of joint is the glenohumeral joint? You know that it is a ball and socket type of joint, right? It is a ball and socket type of synovial joint. Definitely, then it will have how many degrees of freedom? It has 3 degrees of freedom, right? 3 rotatory degrees of freedom as well as 3 translatory degrees of freedom. These are all very easy steps, and you know that the 3 rotatory motions are, any one of us can simply tell it, that is a flexion and extension, that is the abduction and adduction, and the internal rotation as well as external rotation, or the lateral rotation, or medial rotation and lateral rotation, right? So we have been discussing about the glenohumeral joint range of motion. Now we need to go in particular about each of this range of motion. For example, let us take the first one, that is the flexion and extension. Okay, flexion and extension. Which plane is this motion happening, and which axis is this motion happening? Can anyone just guess it out? Yes, right now you know that the flexion and extension is a very classical example of sagittal plane movement, and the axis would be definitely x-axis or coronal axis, and the plane of the movement would be which one? The sagittal plane, right? So many of you would have been by hearted this one. Okay, if someone asks you what is sagittal plane movement, you just tell it is shoulder flexion and extension, right? That's correct. It happens in the x-axis and coronal axis, or in the sagittal plane, both flexion and extension. What do you mean by flexion? Oh, I know what is flexion, but don't ask me what is flexion. I cannot define it. Flexion means it's a forward, right? It's a forward and upward movement of humeral head in the glenoid fossa. What is that? The flexion means it's a forward and upward movement of humeral head in the glenoid fossa. What is the extension? Backward and downward movement of glenohumeral joint in the glenoid fossa, or humeral head in the glenoid fossa, right? Yes. Now, how to define it? You define what is flexion, you define what it is the extension, okay? And then what is the normal range of motion? What is the normal range of motion? Don't tell it is 180 degree. That is wrong, because that is the complete shoulder range of motion that is possible with respect to all other joints involved in the shoulder complex. And right now we have a value between 90 to 120 degree. What is that? 90 to 120 degree is the normal value of flexion at the glenohumeral joint. What is that? The flexion at the glenohumeral joint, right? Yes. And extension, it is said to have about 50 degree, but this is the same value that you find in the shoulder complex, so you can take it right like 30 to 50 degree. it is just an approximate value. Why we don't have a standard value is because always the motion in the shoulder takes place together, and studies have been done, but still we cannot have a concise value or standard value of glenohumeral joint involvement alone. So, but still we consider 90 to 120 degree and 30 to 50 degree as flexion and extension that is happening in the shoulder complex, not in the shoulder complex, but in the glenohumeral joint. So if you have to write this for an examination point of view, you just have to write which is the axis, that is x-axis, which is the plane, that is the sagittal plane. You have to define flexion, upward and downward movement, upward and forward movement. You have to define extension, downward and backward movement. You have to write normal range of motion, 90 to 120 approximately, 30 to 50 degree approximately, right? That's all about the range of motion of flexion, right? Yes. So let me ask you, what about the 180 degree that we have in the shoulder complex? Who is contributing that? Yes, that's done by the other joints, most probably by the scapulothoracic joint, which we will discuss later. Right now, let us move on to the second motion, that is, what is that? Medial rotation and lateral rotation. What is that? The medial rotation and lateral rotation. Always the same strategy which helps you to understand and correlate easily. That is the axis, which is the axis for rotatory movements. Definitely that is vertical axis or the longitudinal axis or the y-axis. And what is the plane for that same movement? Definitely the vertical axis movement. The rotatory movements would be happening in the transverse plane, and that is the transverse plane movement. Okay. So what do you mean by medial rotation? Okay, rotation of the humeral head in the medial direction to the midline of the body. Okay, you can define it like this: the rotation of the humeral head to the midline of the body. This is the medial rotation, and rotation of the humeral head away from the body, it is known as the lateral rotation. Rotation of the humeral head away from the body, or rotation of the humeral head laterally. It is better to do it in the lateral manner because we can have the medial rotation and lateral rotation in this degree also. So it won't be towards and away from the body. It is better rotation in the medial direction and rotation in the lateral direction, right? Okay, so that is the range of motion of medial rotation and lateral rotation. What was the movement of flexion and extension? This is the shoulder flexion and this is extension, which he had about 120 and 30 to 50 degree. Don't forget that. Okay, so the axis of the movement is vertical and the plane is transverse plane, and medial rotation is rotation to the medial plane or the midline of the body or in the medial direction, and the lateral rotation is rotation in the lateral direction. What is the range of motion? Yes, what is the range of motion? This is something most important. Of course, we see that medial rotation has a range of motion of about 70 to 90 degree, and lateral rotation has a range of motion about 80 to 90 degree. Mostly you can take it, both of them are about 90 degree, and this is the same range of motion that you find out in the shoulder complex also. So we cannot specifically mention whether it is range of motion in the glenohumeral joint or in the shoulder complex alone completely, but still we can take it as medial rotation 70 to 90 degree and lateral rotation 80 to 90 degree or approximately 80 degree. In some text you might find it is 80 to 90 and here 70 to 90. That's almost the same values, and just the measurement difference or just the method different what they follow. Right now we discovered medial rotation and lateral rotation, but I want to ask you, there is something that you need to understand about the medial rotation. For example, when your arm is at side and when you go for the medial rotation, the range of motion that is possible, can you just try this with me? Just keep the arm in your side and try this medial rotation and try lateral rotation. You can see that the medial rotation and lateral rotation that is possible is a bit decreased, is a bit less. Whereas you just take the arm to a 90 degree of abduction and you just try the medial rotation and lateral rotation, you can see that the range of motion possible is a bit more high. Why? What is the difference? That is because, just see on this diagram example here, this is the glenohumeral joint, and you see that we have the greater and lesser tubercles over here. Now imagine a situation, I'm going for medial rotation with arm at side. See, these tubercles are actually coming in contact with the glenoid fossa, or the tubercles are restricting the range of motion that is available. So this is something that you should remember. When the arm is at side, the medial rotation and lateral rotation are restricted because of the difference or protruded appearance of greater and lesser tubercle that is going to restrict the range of motion. So this is some applied aspect that you have to remember. But for example, the same arm, if it is abducted to about 90 degree, see the impact of the greater and lesser tubercles almost gets nullified, and there is a greater amount of range of motion that is possible. So if the arm is elevated to a 90 degree or abducted to 90 degree, the range of motion that is possible in the glenohumeral joint increases in for medial rotation and lateral rotation, and you find a value about sometimes 130 degree, which is much higher than this value. That is because the greater and lesser tubercles are no longer obstructing the pathway of the path of movement for the glenohumeral joint or the humeral head. Right now, yes, now we move on to the last range of motion that is possible, or the last motion that is possible, is the abduction and adduction. The abduction and adduction, and let us examine in the same manner. The axis of the movement is in the which one? In the AP axis. Right now, you know that, and the plane of the movement would be definitely which one? Which one? The frontal plane. So abduction, adduction is a frontal plane movement. If anybody is having any confusion with regard to axis and plane, refer back to our video on axis and plane, which will definitely help you in mastering that concept, which is very crucial for biomechanical understanding and discussion. And how you define abduction and adduction? Abduction is elevation of the arm in the frontal plane, or upward movement of the arm in the frontal plane. This is the frontal plane, and this is the movement that is going to happen. This pen indicates, or this marker indicates, the axis, AP axis. So elevation of the arm in the frontal plane, or upward movement of the arm in the frontal plane. If it is in the sagittal plane, it becomes flexion. This is happening in the frontal plane. And depression or downward movement of the arm in the frontal plane, or bringing of arm towards the body, is known as the adduction. Okay, and right now let us look at the value of range of motion. The range of motion of abduction is said to be about 90 to 120 degree. What is that? The range of motion of abduction is said to be about the same as the value of flexion, is 90 to 120 degree. Whereas adduction, glenohumeral adduction, is mostly considered to be a 0 degree. The glenohumeral adduction, because this is the abducted position, and from there you bring near to the body, you consider it as 0 degree. But when you consider the shoulder complex as a whole, you take it about 50 degree. When you take the whole shoulder complex as a whole, you take it about 50 degree, because you can abduct it this manner. So this is the midline of the body. From there, you can take your arm in this direction. So here, this angle is made that can be about 50 degrees. So this is the abduction, and this is the adduction for the glenohumeral joint, which is in fact 0. Whereas for a shoulder complex as a whole, you can take it as a 50 degree. So these are the 3 important motions that you need to remember: flexion, extension, abduction, adduction, medial rotation, lateral rotation, the same medial rotation, lateral rotation. Right? Whereas you need to remember, similar to the peculiar condition in medial rotation and lateral rotation, the same thing happens in abduction and adduction also. When arm is in the neutral position or medially rotated position, the range of abduction is restricted. Why? That is because the same humeral head or the glenoid or the tubercles of the humeral head, that is a greater and lesser tubercle, can get impinged with the, here not with the glenoid fossa, but with the coracoacromial arch. So if arm is in its neutral position and medially rotated, either in its neutral position or medial rotation. The abduction range of motion is restricted. That is because the head of the humerus or the tubercles can get impinged with the coracoacromials. But if you are opening the arm like about 35 to 40 degree of abduction or lateral rotation, more clearly lateral rotation, the greater tubercle just skip away from the coracoacromial arch. So no longer that arch is going to obstruct the range of motion. Is it clear? I think I need to explain it once again. That's a simple concept, right? You just imagine this is the situation. You have the greater and lesser tubercles, and now you go for abduction in this position. This is a medially rotated position. You can see that the tubercles, this one, can get impinged with the coracoacromial arch more easily, right? More easily. But the second scenario is when it is externally rotated. You see that the tubercle is no longer in the pathway of coracoacromial arch. So you go for abduction like this. A greater amount of abduction is possible. That means when the arm is in external rotated position of about 35 to 40 degree or 45 degree, the range of motion that is available for glenohumeral joint abduction increases. That is the same thing. You keep it in the medial rotation and go for abduction. You can feel that it's been restricted, but you just slightly open it, you can get greater amount of abduction in the shoulder or in the glenohumeral joint. And there are some other movements which are not the functional or cardinal plane movements, which is a combination of movements like the one known as the circumduction, which involves flexion, abduction, and extension and rotatory movements. All movements combined, it is becoming the circumduction. More than that, there is another movement known as horizontal adduction. See, this is the horizontal plane, this is the horizontal plane, transverse plane, combined with that transverse plane movement, combined with the frontal plane movement. That is the horizontal adduction. When adduction is in the horizontal plane, you can see that the value is quite different from the normal adduction. And horizontal abduction in this plane also, which is about 50 degree, and this one can be in the same plane, horizontal abduction, horizontal adduction. So the total range of motion or the movement that are seen in the glenohumeral are three cardinal plane movements, which is the flexion-extension, medial rotation, lateral rotation, and abduction adduction. In addition to that, you have the circumduction, which is a combination of all the movements. You also have, or we have, horizontal abduction and horizontal adduction, which is a combination of movement in the transverse and frontal planes respectively. There is abduction plus flexion happening in the horizontal abduction and adduction, right? So what are the rotatory movements of the shoulder complex, the glenohumeral joint, we already discussed. Now we need to see which are the translatory movements in the glenohumeral joint, and definitely you know the translatory movement, these are the same in all the shoulder joints, that is anterior and posterior movement, that is superior and inferior movement, that is medial and lateral translatory movements. So these are the three translatory movements that you can see in the glenohumeral joint or almost all other joints in the shoulder complex, which is anterior and posterior translation, superior and inferior translation, and medial and lateral translation. It's not the medial rotation, sorry, it is the medial and lateral translation itself. Medial and lateral translation. Okay, medial and lateral translation. But I want to take you to a concept which is much more important than this one, that is the intra-articular movements. Intra-articular movements in shoulder joints. Okay. Now, so far we were telling the blah blah about the shoulder range of motion, the glenohumeral range of motion. But you must remember that the glenohumeral range of motion would not be possible in the so-called 90, 120, 50, 60 if there is no intra-articular movements. What do you mean by that? The movements that are going to take place or movement that should take place inside the joint. If that movements are not there, or if that movement do not occur in synchronization with the external movement or extra-articular movement, you cannot get the normal complete range of motion in the shoulder complex or in the glenohumeral joint. So we can summarize that to achieve complete range of motion in the glenohumeral joint, the intra-articular motions are very, very crucial, right? So what is intra-articular movement? Or what is arthrokinematic movement? That's so easy to remember. We studied already rolling, sliding or gliding, and spinning is the movement that is happening in the arthrokinematic movement of the body. If anybody is unaware about rolling, sliding or spinning or arthrokinematics, just refer back to our video. It will let you be clear with this concept. I will give the link with the description and above them. Okay, right now. So the rolling, sliding and spinning. So in the glenohumeral joint, there is a lot of functional or articular incongruence, and you cannot find out pure spinning movement that is happening. Instead, you have a combination of rolling or sliding or gliding. Better you call it as gliding. Okay, rolling and gliding. So there is no pure spin movement because of the incongruency of the articular surfaces, and we have a combination of roll plus glide or slide happening. Now, how is it going to happen? Let us check. Just pay attention to this. This is quite important, and it may be a bit tricky to understand too, right? So this is the glenoid fossa, this is the humeral head, and you have the coracoacromial arch over here. Even though you don't have the ligament over here, just imagine there is that ligament. And now in this scenario, you are going for the abduction of the arm or elevation of the arm. Remember, take into consideration that there is no intra-articular movement happening. So the humeral head is in its position itself and it is going for abduction. Can you see that? Can you see the difference? The humeral head will soon come in contact with the coracoacromial arch. The humeral head will go in contact or get impinged with the coracoacromial arch if the movement is just the flexion or abduction happening. Okay, but what happens is that now when the humeral head is going for abduction like this, okay, what will happen inside the joint is that the humeral head will glide in a direction that is opposite to the rolling. Why do I say it is opposite to the rolling? Why can't it be in the same direction of rolling? That is because this is the convex moving on the concave. What is that? This is the convex moving on the concave, and you can apply concave convex rule, which says that if a convex is moving on the concave, the arthrokinematics and osteokinematics occur in the opposite direction, or more clearly, the rolling and gliding will occur in the opposite direction. So the rolling is in the superior direction, so the glide would be in the inferior direction. So what is happening here? It's not just that we apply some rule and tell it with the blind eye, oh, it's happening like that. It's not such. We need to understand what is happening. So if there is no gliding happening, it will come in contact with the arch like this, and you can see that it is coming in contact with the arch, and it won't allow the abduction or elevation to happen. So in order to prevent that, you can see from here, along with the rolling, there is a slight amount of inferior translation happening, inferior gliding happening. So rolling is in superior direction, gliding is in the inferior direction. Can you see that this inferior gliding will enable humeral head, or will prevent humeral head from getting in contact with the coracoacromial arch? That impingement is being avoided. So this is the intra-articular movement that you need to remember in shoulder abduction or elevation. When the humeral head grows superiorly, there is the head of the humerus moving in the inferior direction, or glides in an inferior direction. Why is it done? It is done in such a way that the humeral head do not get impinged with the coracoacromial arch. If there is no gliding, if there is no inferior gliding happening, the humeral head will go in contact with the coracoacromial arch and restrict the range of motion possible. So that is the superior rolling and inferior gliding. Similarly, if you are going for adduction, from this position, the rolling will be in the downward direction and gliding will be in the superior direction, which is very simple for you to understand. So just understand the previous concept or previous example. In abduction of the arm, the humeral head goes for your rolling, and at the same time the humeral head goes for inferior gliding. So the roll plus glide takes place in the opposite direction in the humeral head, which we can clearly state with the help of convex concave rule. So this is done to prevent that contact with the coracoacromial arch. So far it is clear, I think so. But I'm going to take forward, or I'm going to take you to a bit confused aspects. I'm forced to do actually, because we don't have exact literature stating a correct definition of the things that I'm going to tell just now. Okay, after this, that is, so far before this one, we discussed about the translation, that is anterior, posterior, superior, inferior, medial, lateral. Now, when is this translation happening? Along with this intra-articular motion, it is not just the inferior gliding. Of course, you can consider this inferior gliding as the inferior translation. No problems in that. Along with that, up to 60 degree of abduction or elevation, the study shows that there is a slight movement of the humeral head upwards. Slight movement of the humeral head upwards, which can be in which direction? In the superior direction. So, in the initial degree of glenohumeral joint range of motion, the humeral head may slightly go upwards. May go slightly a bit upwards, about 1 to 2 millimeter. Just that much only, just 1 to 2 millimeter. It may glide upward along with the starting of the range of motion in abduction or in adduction. Okay, and this can happen. That means the superior translation of the glenohumeral joint is also seen in abduction or elevation. That is, during the initial stages, there is about 1 to 2 millimeter movement. But after that 60 degree, the head remains constant. It won't go for translation. Even though you force him to go for the translation, it won't go for the translation and it remains fixed. So up to 60 degree, that can be seen. Then what about the anterior and posterior? It's fine. Superior and inferior, of course, superior and inferior is fine. What about the anterior, posterior? Similarly, in this abduction or adduction or flexion, there is about 1 to 2 millimeter movement of the humeral head in anterior and posterior direction, but we cannot tell it in which degree of the range of motion. Studies have not found out. Some says that it is in the initial degree, some says in the final degrees. So just remember, along with humeral head abduction or adduction or flexion, there is a slight anterior translation of the humeral head as well as slight posterior translation. The same with medial and lateral rotation also. There is a slight amount of medial and lateral movement, not rotation, medial, and this is the lateral movement. This is the lateral movement away from the glenoid fossa, and towards the glenoid fossa is the medial movement also happening. But when it is happening, don't ask me, because we don't have a correct answer. So if you're a student who wants to write this for an examination, just avoid this last points, because that's not much needed. Just write about the inferior gliding. That's fine. If you can just go on to that, at least add superior translation, which is happening in 1 to 2 millimeter in the initial 60 degree. But if you are doing this motion actively, it is the 1 to 2 millimeter. But if you are doing this passively, you can have about 5 millimeter. You can have about 5 millimeter translation in the glenohumeral joint. So with this, we wind up the session. Before that, I would like to remind you, we have the rotatory movement, we have the translatory movement, and we have an intra-articular movement which is occurring opposite in this joint, which is very specific. These translatory movements and intra-articular movements are sometimes confused together, and we cannot differentiate it. It is better we call inferior translation as the inferior glide itself and superior translation as superior glide itself. It's not a very tough task, but just understand it in that way. That helps us in understanding the concept. The problem is that, as I told earlier, the glenohumeral joint motion alone is very difficult to isolate, and we don't have the greatest technologies and advancement to isolate it and study. So our studies are being limited. Now, to add on to this one, I would like to tell you that the glenohumeral joint capsule has some role in the glenohumeral joint motion. How is that? The capsule during the initial degree of range of motion, it has no role. Yes, it has no role in the initial degrees of range of motion. But when it reaches the extremes of range of motion, the anterior, posterior, superior, inferior aspects of the capsule gets tight. Then the capsule restricts the range of motion. So when arm is at side, just the superior capsule is tight, and what will happen? There is no much restriction possible with the capsule. But when arm is reaching its extremes of range of motion, or from the mid range of motion, the capsule gets tight and it can restrict the range of motion. And its extremes of range of motion, it's not just a restriction, the capsule causes the range of motion. How is that? Am I making you confused? If yes, just wind up with this one. You need not really listen to what I'm going to tell you now. Okay, so just remember, but it is fun to learn. Just listen to that. So at the end of the range of motion, for example, abduction end. Okay, this is the end of abduction. What is happening is there, the anterior capsule will get tight, whereas the posterior capsule will get loose. So this anterior capsule can pull this one, the humeral head, or push the humeral head into the posterior direction. So when it is the end to range of motion, for example in flexion end, the capsule will pull the humeral head in backward direction. When it is in the extension end, the capsule will pull the humeral head in the anterior direction. When push, it's not pull, it's push. Okay, when it is abduction end, the capsule will push the humeral head in the opposite direction. That means the role of the capsule is a bit opposite to each other. That is in normal range of motion and in resting position, capsule has no role except the superior capsule. In mid range of motion or in up to the extremes of range of motion, it restricts the range. At the extreme range of motion, it causes the range of motion, or it causes the movement, at least in the opposite direction. So when flexion, it is in the extreme range of motion, the head of the humerus may move posteriorly because the capsule is tight in this aspect, whereas in extension it may move anteriorly because capsule is tight in this aspect. I hope that is clear. Some of this concept may be a bit difficult to understand. If you have any difficulty in learning that, just keep on to that and remember the basic ones, which is essential for your examinations. And if you are interested to learn in this practical life, just explore this and read on to available literature to arrive at a conclusion. And in next video, we will be discussing about the most crucial static and dynamic stabilization in the shoulder complex. Until then, stay tuned, and if you like the video, don't forget to click the like button and kindly subscribe to our channel.